The main indication for knee joint replacement is arthritis, and probably 95% of all cases are done due to knee joint arthritis. Also, some surgeries are done due to osteochondritis dissecans. Then a part of the bone is necrotic, and then this problem can be solved using knee joint prosthesis. We operate knee joint via anterior approach. We approach the tibial bone, and we do perpendicular cut of tibial bone to get rid of damaged cartilage, to make the spongious bone open. After we identify the femoral canal and implant the rod in the femoral canal to do the measurements, to restore the mechanical axis to 180 degrees. And after using special guides, we do bone cuts on the femur. It's usually 4 cuts to form the shape of the femur according to the implant, which needs to be implanted eventually. After the components, the bones are prepared, the components is implanted using bone cement, which fixes component to the bone. The bone has some spaces, gaps, so-called cancellous bone, and the cement penetrates into the cancellous bone. And the other part of the cement penetrates into the implant. And that creates interlock between the bone and the implant. Then components is implanted, both femur and the tibia. We use polyethylene liner, which is placed onto the tibial component, and the articulation in the knee joint is between the polyethylene liner against femoral component. After all the parts is implanted, the wound is closed. Recovery after knee, usually it might take up to 1 year. So that means that even though after 3 months or 4 months or 5 months you feel some swelling, some light pain, some issues, you should not be worried about it so much, because the recovery takes time. Because all the inflammation process around the implant continues up to 1 year. So you have to be patient and wait, then your knee will improve. And it is normal that you might feel some slight symptoms for a longer period. But patients already feel better at 6 weeks, and at 3 months the pain level is decreased as compared to the pain as patient had before surgery. The main complication of knee replacement is infection. It can be a bell 2%. Other complication can be some bleeding, some wound healing disturbances. It can be also fractures after the surgery. The rate of complication is quite low. Patient can put full weight on operated leg the day of the surgery. So that means when anesthesia will evaporate, patients will start to feel their legs completely. They are free to stand up on their both feet with a full weight bearing and do a few steps immediately after surgery. Patients need to use crutches for about 3-4 weeks after surgery. At 3 weeks time point, patients should get rid of 1 crutch, and in the following week of the last one. Patients can drive about 3-4 weeks after surgery. Patients can come back to their work activities from 2 to 3 months after surgery. No braces are needed after knee replacement.